Hello, welcome to New Jersey Power and Politics. I'm Alex Zdan. Federal regulators are examining the single-shot Johnson & Johnson COVID vaccine to determine if it contributed to serious blood clotting in 6 women out of 7 million vaccinated so far. For perspective on what happens next, we're turning to the Dean of Rutgers School of Public Health. Dr. Perry Halkitis created the state's contact tracing program and has been working on combating vaccine hesitancy. Welcome back to the show, Perry.
Hi, Alex. Good to see you.
So what are the FDA and the CDC doing right now to make sure the J&J vaccine is safe, and how long is that process going to take, you think?
So the FDA and the CDC are continuing to examine whether or not there is any more adverse effects related to the J&J vaccine. Remember, it's only a handful of cases that have been identified so far. So there's ongoing monitoring and safety trials going on to identify if there are any more cases, and also to establish what is the cause-effect relationship potentially between the vaccine and these adverse events that have been identified in these women. So I expect that we will have a speeded up process, and it is my expectation that by April 23rd, the FDA and the CDC have said we should have some more information on whether or not there are any more adverse events related to the use of the vaccine.
And we've said 6 people out of nearly 7 million vaccinated. Obviously, right. Tragic for those 6, including the person who passed away. But do you believe that the FDA overreacted?
I believe that we have amazing safety precautions in place, and that the FDA did what it should do to be careful and in order to be able to ensure the safety of the population. Look, we have a history of vaccines in this country tracing back decades. And in earlier cases, like the Cutter case in the 1950s with the polio vaccine, 250 people were paralyzed because they received, live polio as part of their vaccination. So we've learned since the 1950s, and being more cautious and being more conservative is ultimately what the population and what the public is expecting of the FDA and of the CDC.
With this pause factored into it, do you still think the state's going to make its goal of 70% of the adult population in the state vaccinated by June 30th?
I do believe the state will make its goal. I think that the whole country has been ramped up over the last couple of months in terms of vaccination, getting close to millions of doses being undertaken on any given day. And so I still am very strongly going to stick to my original proposition, which is that by July, we should have the majority of adults in the state of New Jersey vaccinated.
And this pause on the J&J vaccine, how concerned are you that that's going to increase vaccine hesitancy?
I'm always worried about vaccine hesitancy. I think that what we have to realize is that vaccine hesitancy is not one thing. Vaccine hesitancy manifests in lots of different ways. So for some people, it's about, COVID-19 being a hoax. For other people, it's a history of being treated in horrific ways by the medical profession. This now just adds another opportunity for people to find an excuse not to take the vaccine. So I am worried about it, but I want to make sure that people understand that 6 cases, while completely horrific and tragic, and every life matters, is negligible amount of adverse effects. Right? It is a minimal amount of effect on the well-being of the population. And so I need people to trust that the vaccines are working and that they are mostly, and if not completely, safe. And as a result of that, should not use this as an excuse not to get vaccinated, because the more people do not get vaccinated, the more likely it is that a variant will develop in our mix that will then not be treatable by the vaccines or not controllable by the vaccines that we currently have in place.
So this week, the CEO of Pfizer announced that they believe that people who got the 2 are going to need to get a 3rd one in 12 months. What do you make of that? And is getting a COVID vaccine going to become an annual thing for people?
Yeah, so I'm not surprised at all that the Pfizer vaccine, this Pfizer CEO said that we would need a 3rd dose. Look, there's like over 4,000 variants out there. For the most part, it looks like the vaccines that are in place right now are actually effective in terms of most of the variants. So the booster is just another added layer of protection. I will say, though, that I fear that COVID vaccination will become an annual reality for us because there is still a segment of the population, those who are hesitant, who are not getting vaccinated, that are going to enable the virus to continue to exist in our population and to continue to mutate and for variants to develop. And as a result of that, I implore all of those people who are not taking their vaccination to please take the vaccination if you don't want this to be an every year occurrence.
All right, Dr. Perry Halkitis, Dean of the Rutgers School of Public Health, thank you for joining us.
Thank you, Alex.